Hi, I'm glad to be able to be with you, but I do apologize for not being able to be there in person. I'm stuck in Washington right now making last-minute preparations for a trip leaving tomorrow night to the international climate change negotiations in Poland. And obviously, I know all of you feel this. This is an enormously important meeting leading up to our negotiations next year in Copenhagen. Frankly, just like the global climate challenge, the global AIDS epidemic is a threat that respects no borders. It's a moral test, and it's also a major test of our global leadership in the years ahead. So I'm glad to be able to share a few thoughts with you about it. All of you here today are helping us to rise to the full level or full measure of that challenge. Physicians for Human Rights, AIDS Action Committee of Massachusetts, Partners in Health, and the FXB Center for Health and Human Rights. I want to thank each and every one of you for years of leadership and of advocacy, from the early days in the wilderness of neglect and denial to the central role that AIDS plays today in our global public health efforts. I also want to acknowledge a longtime champion of health care and social justice for everyone, and especially for the HIV positive. My dear friend and our senior senator from Massachusetts these last 24 years for me, Ted Kennedy. I can't wait to have Ted back in the Senate this January, ready to fight as he is for health care for all Americans. And as you know, he's been fighting for decades to make that health care a right, not a privilege, for each and every single man, woman, and child in our country. I have personally seen up close the ravages of HIV/AIDS, both here at home and also across the planet. Last November, my wife Teresa and I traveled to South Africa, visiting the Umgeni private school and talking with people in poverty-stricken Kwangolosi near Durban, South Africa. We saw the most inspiring and the most heartbreaking at the same time, the most courageous and the most frustrating realities of a global struggle to defeat a global scourge. We met young orphans, some HIV positive themselves, who shouldered absolutely heroic burdens thanks to a disease that had robbed them of their parents. Many were caring for several younger brothers and sisters, and we were inspired by the work of caregivers who devote their lives to helping the region's AIDS orphans. These are just some of the human faces behind the numbers, which are truly staggering. 12 million African children have lost one or both parents to HIV/AIDS. Some 30% of the world's orphans today are AIDS orphans, many raised by village women who have all too commonly become known as AIDS grannies. Here in America, there are over 1 million people with HIV/AIDS. We still are in need of a major effort, and we can't stop at this point sort of just looking at the water's edge. As incoming chairman of the Senate Foreign Relations Committee, I intend to fight to see that our struggle against this global epidemic continues and, in fact, grows. Back in 2002, I had the privilege of working very closely with then Majority Leader Senator Bill Frist from Tennessee. And together, he and I wrote a comprehensive HIV/AIDS bill that laid the foundation for what became PEPFAR, a program now in 15 countries, assisting 10 million people, including 5 million AIDS orphans, and preventing 7 million new infections, and helping to provide life-saving antiretrovirals to 2 million people. It's quite an extraordinary story. It's really the greatest health program, global health program anywhere in the world. And Americans need to be proud of the fact that we've put this in place. As impressive as the bad news has been, these figures that I just articulated are really staggering numbers, and they're numbers on the upside. Since 2003, we have spent over $15 billion on the largest international health expenditure ever to fight one single disease. It has saved literally millions of lives, even as other policies failed. A truly bipartisan effort to combat HIV/AIDS from the President and the Congress in recent years has offered the world a preview of just what is possible when our nation's policies and practices reflect the very best of our ideals and principles. I'm proud to have helped lead the fight for reauthorization of PEPFAR this year. I also want to tell you about a specific measure that Senator Gordon Smith and I included in the bill. Today, hopefully not for long, we are just one of 12 countries that prohibits, almost without exception, HIV-positive non-citizens from entering this country. Frankly, that's ridiculous policy. Knowing what we know today, we actually restrict immigration for people with Ebola or avian flu less categorically than we do for those with AIDS. Well, here's the good news as a result of what we've done. Our legislation has ended the statutory ban on immigration for the HIV positive. And now Health and Human Services is in the midst of changing the rule to end this ban entirely. There remains a little bit of red tape that we still have to get through, but I am excited to report we are very close to making this a more humane and welcoming country in a way that will actually directly impact positively many people's lives. We've come a long way. I'm proud of that. I'm also proud that while an American president once waited years to even say the word HIV in public, the current president doesn't just talk about fighting the disease, but he's worked with Congress to put tens of billions of dollars behind those words. Actions do matter. Leading by example in the fight against HIV/AIDS has left millions in the developing world grateful to America for our life-saving help. This fight is not just a first-tier priority of our foreign policy and public health. It's also an inescapable test of our values. We can celebrate our successes at home and abroad. What we cannot and must not do is let up even a little. So I ask you now, let's all keep doing what has brought us here today. Challenge ourselves to do better until we defeat this awful epidemic once and for all. Thank you, and God bless.